I'm Dr. Judy Melinek. I'm a board-certified forensic pathologist, and I just watched the Nolan Wells press conference, and I wanted to share some context for everyone. Being able to definitively state the cause of death after a body has not been found for several days and has been subsequently autopsied twice with signs of decomposition is incredibly unlikely. Drowning is what's called a diagnosis of exclusion, which means that when you've got a fresh body, you want to be able to look at the body and see if there's any other causes of death for that body that is found in water that exclude the death being exclusively a drowning. So, for example, if someone is shot and then thrown in the water, you'll have that gunshot and they'll be bleeding and the gunshot will be the cause of death, and the thrown in the water is not the cause of death. It's not even on the death certificate. If a person is strangled and they die from strangulation and then their dead body is thrown in the water, their body will take on water, but the cause of death is going to be strangulation, not drowning. Also, for any kind of traumatic injuries. Now we got to talk about natural death for a second. If someone has a heart attack while they are swimming, and because they're having the heart attack as they're exercising in the water and they take on water and they drown, the cause of death is actually drowning, and the heart attack is listed on the death certificate under other significant conditions contributing to death. So even though the heart attack might have killed them on dry land, it might not have. Most certainly they wouldn't have drowned on dry land. So we defer to the hostile environment, which is the water, to call it a drowning. Now, identifying natural disease and identifying trauma is relatively easy in a fresh body. It can be very difficult in a decomposed body. His body was found 2 days after he disappeared, and this second autopsy done by Dr. Roger Mitchell wasn't until 4 days later. So we're dealing with quite a bit of decomposition, even if the body was refrigerated during that time. And then we have this other issue of the fact that not all the results are back. The toxicology would have been done on the fluids from the body from the first autopsy. From the second autopsy, you're going to have a lot higher alcohol levels from the decomposition caused by bacteria, not caused by drinking. So again, it's the fluid and blood from the first autopsy that really matter. And the other thing you have to consider, and there's one other important piece of information from that press conference, which is that the neck block, the portion of the neck from the front end, was missing. So Dr. Mitchell did not have a chance to examine that part of Nolan Wells' anatomy. Why is that important? Because if somebody is strangled, especially manual strangulation, the injuries are going to be to the front of the neck. There may be some redness at the back of the neck as well if, injury comes from behind, but generally this part of the neck doesn't have the major blood vessels and the airway. It's the front of the neck that does. So compression or damage to the front of the airway, that's going to be found in the neck block that is still sitting at the medical examiner's office that was not released with the body. So you may ask, is this common practice for pathologists to keep a portion of the anatomy with them at the medical examiner's office and not release it to the family? And the answer is yes. We will sometimes retain important specimens that have pathology in a jar under formaldehyde at the medical examiner's office for further examination or as evidence. And the absence of that neck block is really important because we still don't have information from the first autopsy that has not been released yet. So we don't know if it was kept out of an abundance of caution, meaning that it didn't have any findings and it was negative, or it was kept because it has findings, because there's a broken hyoid bone, or because there's hemorrhage in the strap muscles. Until we get that first autopsy report, we don't know why it's been retained. So why should anybody do a second autopsy? A second autopsy is often done in cases where there is a high-profile case such as this, or there is concern from the family for foul play, and they're just not getting answers from the medical examiner's office because the medical examiner's office is still doing their investigation and is keeping things under wraps, because if there is foul play, they have the evidence, they have the physical evidence that might be able to trap the killer, and they don't want to release that to the public. Even if there is no evidence of foul play, just the lack of evidence is evidence and is important information that might affect how people are interrogated, whether they're going to tell the truth or not the truth about what happened to him. You have to understand that the medical examiner's autopsy is legally mandated, and it is ultimately the most independent autopsy because it's not beholden to the family, it's not beholden to the prosecutor, to the police, to anybody else. It's an independent agency. So that is an independent autopsy, but it takes time. And it takes time until we get all the information back, including the toxicology report. And to answer the question, if somebody's intoxicated and they drown as a result of their intoxication, meaning that they're just, too intoxicated to be able to swim adequately, the cause of death would still be a drowning, but the intoxication would be considered a significant contributing condition. But because of what I said about alcohol forming from bacteria after death, if the body is decomposed, you have to subtract some of that alcohol because it may have been caused by bacteria and may not have been a sign of intoxication. And you can have up to 0.20 gram percent. So 0.08 is above the legal limit in most states for driving, but you can get up to 0.20 in a massively decomposed body. So it really throws you off when you have decomposition and alcohol to try to figure out whether there was alcohol on board or whether all of it's just been made by bacteria. So I hope this answers some questions about what I saw in the press conference, what other people saw as well. I will go through the autopsy, or at least the report that's been released, with a fine-tooth comb, but this is just my first impressions based on watching the press report.
There's a term forensic pathologists use that most people have probably never had a reason to learn: diagnosis of exclusion. It means you cannot simply label something a drowning because a body was discovered in water. You have to eliminate every other reasonable possibility first. And in this case, that process was never completed, not even close. Tonight, we're going to break down exactly why a board-certified forensic pathologist, someone with no ties to either side of this case, has reviewed what's publicly available so far and said she cannot be certain the official ruling is correct. And we have something new to bring you. At the National Urban League Convention, Nolan's legal team just revealed that they've hired some of the country's leading audio engineering specialists to formally analyze that emergency call, the actual recording, from beginning to end. This isn't some amateur AI experiment or a TikTok audio enhancement. This is a legitimate professional forensic examination. We're going to approach this carefully tonight, because it would be easy to take a legitimate forensic question and make it sound bigger than the evidence actually allows. We're not going to do that. We're going to show you exactly what a qualified doctor has said in her own words and exactly where the genuine uncertainty in this case remains.
Tonight, we're breaking down the preliminary findings of that second autopsy. I spoke with Dr. Judy Melinek, a board-certified pathologist who is not affiliated with this case, about the report. So in cases where a body is found in or around water, what do forensic pathologists tend to look out for when conducting an autopsy?
When a body's in water, it's not always clear whether they died as a result of being in the water, meaning that they drowned, or they died of something else and they were just disposed of in the water. So if there is traumatic injury to the body, like a stab wound or a gunshot wound or strangulation that would kill the person, generally we will defer to that as the cause of death. We will say the cause of death is the trauma and being in the water is irrelevant. Versus if we find, for example, a natural disease process like a heart attack, then if a person had a heart attack while they were swimming, we would still call that a drowning, but we would acknowledge the heart disease as a significant contributing condition. And the same thing would apply for something like drugs or alcohol that incapacitate you and cause you to drown. The cause of death would be drowning, but we would put the drugs or the alcohol as a significant contributing condition.
In the preliminary discussion of the report, the forensic pathologist mentioned several limitations he encountered, one being the absence of several neck structures. For most people, that kind of sounds odd that the body was sent without those parts, but as the report states, that's actually a common forensic pathology practice. Can you explain why those structures might have been kept during the initial autopsy?
So the neck structures would be where you would see any evidence of injury to the neck or potentially strangulation injury. Retaining those structures does not necessarily mean that they have trauma there. They may have been retained out of an abundance of caution, but they may have also shown some sort of injury or disease process like obstruction that necessitated their being kept by the medical examiner because it's evidence. So retaining tissue or organs in a high profile or suspicious case is common practice for a medical examiner and is not sign of any kind of conspiracy or cover up. That is exactly what the medical examiner is supposed to do when they have a case where they either find trauma or they don't find trauma, but they want to keep it because of the circumstances and the suspicions that have been raised.
The thing about the second autopsy that really stood out to me was that 12 by 8 inch focal area of red discoloration in the deep soft tissues on the back of his head. And there were no lacerations of the overlying skin or fractures on the skull, according to the report. But can you discuss what could have caused that discoloration?
The second postmortem exam was done on a body that had been several days from being found. So we're dealing with, I believe, 2 days between when Nolan Wells was first missing and when his body was found and then autopsied, and another 4 days that have passed until the second postmortem exam. So the body is decomposed. It falls apart after death, and discoloration could be a sign of injury, like bleeding, or it could also be a sign of some sort of pressure being applied, potentially during the first autopsy itself. So this particular location on the back of the head is a common area where we place a block during the first autopsy, and that may have been the source of the discoloration, and it may have absolutely nothing to do with trauma. The only way to know is to get pieces of tissue under the microscope, and that is something that Dr. Mitchell, the pathologist who did the second autopsy, is going to be doing to look to see if that discoloration is bleeding or hemorrhage.
Why might the initial autopsy not have included a dissection of the back of the head where that discoloration was found, like the second autopsy did?
In part, a first autopsy pathologist might not autopsy that area or dissect that area because they don't see anything on the surface of the skin when the body is fresher. So they don't suspect that there's any trauma there. And they may have other parts of the body that have significant findings that they're focusing their attention on. So it's not unusual for a second autopsy pathologist who's given a body that is starting to decompose to work harder to look at areas that the first pathologist may not have looked at because they hadn't suspected injury there, since when the body was fresh, they didn't see any external signs of injury.
And we're all, of course, still waiting on that toxicology report from the initial autopsy. Yeah. Now, based on these preliminary findings that were laid out in this report and the questions that still remain about the circumstances surrounding Wells's death, could this case really come down to that toxicology report?
I doubt it. It's not a single report that answers any question. It can give you a piece of the puzzle, but you really need the scene and the circumstances. What is going to make or break this case is going to be the police investigation, finding out exactly how he got into the water, whether he was alone or whether there were other people with him at the time. That's going to make the difference in terms of determining whether it was an accident, as in an accidental drowning, or potentially a homicide.
Before we go any further tonight, there's one term we need to understand clearly, because without it, much of this case simply doesn't add up. Drowning is what forensic experts call a diagnosis of exclusion. That isn't a phrase pathologists throw around casually. It means an examiner cannot simply see a body recovered from water and immediately list drowning as the cause of death. Water can hide almost anything. A person can truly drown, or they can die from an entirely different cause and end up in the water afterward. And when a body has been submerged for any significant amount of time, those two situations can look remarkably alike. The responsible way to reach a drowning conclusion is to work backward first. Rule out head trauma, rule out injuries to the neck, rule out drug toxicity, rule out internal injuries. Only after every other reasonable explanation has genuinely been eliminated can drowning properly become the conclusion recorded on a death certificate. Here's why that distinction matters so much in this particular case. Within days of Nolan disappearing, before an autopsy had even taken place, and before a pathologist had examined the body, the Jackson County Sheriff publicly told reporters that there was no foul play involved. At that point in the timeline, that conclusion had not yet been established. It couldn't have been. The process that should come first, eliminating every other possibility, hadn't happened yet. To be fair, something observed at the scene may have influenced that statement. A field observation is not meaningless, but an observation made at a scene is not the same thing as a documented, peer-reviewed forensic finding, and it isn't something an outside expert can independently evaluate or verify. And when a sheriff makes a statement like that on camera, it carries enormous influence with the public, whether the scientific evidence behind it exists yet or not. Once officials publicly describe a death as an accident, that framing can follow the case everywhere afterward. It can influence how aggressively evidence is investigated. It can affect how the public interprets every new piece of information that emerges later. The proper sequence is simple: examine first, conclude second. In this case, that sequence was publicly reversed within days. And once that happens, reversing the perception becomes incredibly difficult. Quick gut check before we continue. If a sheriff stood in front of cameras and told you there was no foul play involving your own child before even one autopsy had taken place, would you accept that because he's the authority, or would that be the exact moment your confidence started to disappear? Comment, trust the badge, or trust nothing yet. Let's see which one wins tonight. Nolan's family did not quietly accept that reverse sequence, but they also didn't respond by going on camera in outrage. Instead, they took another route. They hired their own independent pathologist and brought in Ben Crump. An independent autopsy was performed on July 10th, several days after Nolan's body was recovered. That gave another examiner an opportunity to compare the state's conclusion against the physical evidence firsthand. But a second autopsy is never a completely clean reset. And this is something that doesn't get discussed nearly enough. By the time the second examination happens, time has already changed the evidence. In forensic science, time destroys information. It doesn't preserve it. A body is essentially a physical record, but it's a record that deteriorates with every passing hour. Nolan's body had already been in the water for days before it was recovered. It then underwent the state's initial autopsy. Only after all of that did the independent examiner finally have the opportunity to conduct his examination. Refrigeration can slow decomposition. It cannot stop it. In effect, the second pathologist was examining a document that had already been exposed to the elements, and the conclusion from that independent examination was not accident. But it wasn't homicide either. It was something more specific, and in many ways, more cautious, undetermined. That word is constantly misunderstood, so let's be very precise about what it means. Undetermined does not mean that nothing happened. It does not mean the family's concerns are automatically justified. It means the available evidence was not strong enough to definitively eliminate every possible explanation and settle on one. One side presented a quick, confident conclusion within days. The other side, after a more cautious examination, acknowledged that certainty simply wasn't possible. That isn't merely two experts arguing over how to interpret the same evidence. It is a trained professional refusing to claim more certainty than the evidence can actually support. Real talk before we continue. If a doctor told you undetermined regarding the death of your own child, would that be an answer you could accept, or would you demand that someone keep digging until there was more clarity? Comment, I'd accept it, or I'd demand more. Pick one. No fence sitting on this one. Now, this is where Dr. Judy Melinek actually enters the story, and we need to be especially careful about who she is, because she has been mischaracterized online more than almost anyone else connected to this case. People on one side want her to validate a cover-up. People on the other side want her to shut down the entire discussion. But neither version accurately reflects who she is based on the record. Dr. Melinek is a board-certified forensic pathologist with no connection to either side of this case. She wasn't hired by the family, and she isn't working for the state. She is a fully independent, credentialed professional reviewing the publicly available information the same way another forensic pathologist with her training would. Let's begin with something she has been very clear about, because it directly challenges one of the loudest theories spreading online. The fact that certain neck structures were not available when Nolan's body reached the second pathologist has been treated by many people as proof that something was deliberately concealed. But Dr. Mellon's actual position is very different. According to her, retaining tissue or organs in a high-profile or suspicious death is a normal part of forensic practice. It is not, by itself, evidence of a cover-up. A medical examiner may retain those structures simply as a precaution, whether or not anything unusual is ultimately discovered. In her professional assessment, the retention itself is not the scandal that certain corners of the internet have turned it into. That does not mean the missing tissue is irrelevant. It matters tremendously, but for a different reason than many people assume. The neck is precisely where physical evidence of strangulation could potentially be found. Without those structures, the second examiner simply cannot perform that examination, not because something sinister was necessarily done with them, but because if an answer exists there, that is where the evidence could be. And right now, nobody outside the state's own office has been able to independently examine it. Here's where we want you to stop and actually think instead of immediately reacting. If retaining certain tissue in cases like this is simply a routine procedural decision, is that the real explanation? Or is it the kind of official-sounding explanation people accept without questioning, even when it deserves scrutiny? You don't have to choose the cynical explanation. You don't have to automatically trust the official one either. Just tell us what you genuinely believe, and explain why. Group chat energy tonight. Respond to each other, not just to us. Now let's get specific about the finding everyone is actually discussing, because the details matter far more than the headline version. The second autopsy identified an approximately 12 by 8-inch area of red discoloration in the deep soft tissue at the back of Nolan's head. There were no lacerations on the skin above it and no skull fracture underneath. There was simply discoloration in a body that had already spent days decomposing and had already undergone a complete initial autopsy before the second examiner ever received access to it. Here is Dr. Milan's specific explanation for what that discoloration could represent, and it goes beyond simply saying decomposition. That particular location, the back of the head, is a common place for an autopsy block to be positioned underneath a body during a standard examination. Pressure from that block beneath the head during the first autopsy is a real, physical, completely ordinary possible explanation for exactly this type of discoloration, not a strike, not strangulation, possibly nothing more than the position of the body during a routine procedure. According to her explanation, the only reliable way to distinguish that possibility from genuine bleeding or hemorrhage is to examine samples of that tissue under a microscope. And that is exactly what Dr. Mitchell, the second pathologist, still needs to do. She has also addressed another question many people have been asking without ever receiving a straightforward explanation. Why didn't the first autopsy examine that specific area more deeply if it could eventually become this important? Her explanation is fairly simple. A pathologist performing the first autopsy on a relatively fresh body, especially when there is no visible external injury to the skin, may have no reason to dissect a particular internal area when nothing on the surface directs their attention there. That becomes especially true when other findings elsewhere on the body are already demanding attention. In Dr. Mellon's assessment, it is not unusual for a second pathologist examining a body days later, after decomposition has begun, to take a closer look at areas the first examiner had no reason to suspect. That is not proof that anything was concealed. It is simply an example of how an examination performed on a relatively fresh body can reasonably differ from one performed several days later. We're not telling you which explanation to believe regarding that discoloration. We're telling you that there are now two plausible explanations sitting side by side: pressure from an autopsy block or something more serious, and only microscopic examination of the tissue can actually distinguish between them. So what's your call? Block pressure or head injury? Put your choice in the comments and explain your reasoning. We want the real arguments, the kind where people can actually change one another's minds before the thread is over. There's another part of Dr. Melinek's position that deserves serious attention because it corrects a claim that has spread across the internet with enormous confidence. When it comes to toxicology, she has emphasized that any alcohol-related result has to be interpreted in the context of decomposition after death. Bacteria inside a decomposing body can produce alcohol on their own, completely independent of anything the person consumed while alive. So a number appearing on a toxicology report from a body that spent days in warm water before recovery is not automatically proof that the person was intoxicated. Decomposition itself could potentially account for it, and a careful examiner has to consider that possibility before drawing any firm conclusion from the result. But here may be the most important point Dr. Melinek has made throughout this entire case. The one that rarely becomes a headline because it doesn't neatly support anyone's preferred theory. When asked directly whether this case ultimately comes down to the toxicology report, her answer was no. One laboratory result cannot resolve a case like this. It is only one piece of a much larger puzzle. What ultimately determines whether this is classified as an accident or something else is the investigation itself, the scene, the surrounding circumstances, and the evidence. Was Nolan truly alone during his final minutes? Or was someone else there? That is where the case will ultimately be decided, not inside a laboratory, but through the facts investigators either manage or fail to establish about those final moments. One final question for this part, and we mean it. Don't scroll past without answering. Now that you've heard Dr. Melinek's actual position, not the clickbait version, does she sound like someone quietly building toward a cover-up, or someone being genuinely cautious because she refuses to claim more than the evidence can support? Comment your honest assessment below. Tag someone who needs to hear her full position instead of just the headline.
Bombshell tonight, the Nolan Wells autopsy furor. This as the FBI swoops in. Good
I find
evening.
it very difficult to believe that not one, but two medical examiners cannot figure out why he had deep red subcutaneous marking.
And let's see whether this comment section can actually out-argue itself by morning. Different causes of death leave different kinds of evidence in different parts of the body. And when the specific question is manual strangulation, the evidence would generally be concentrated in the front of the neck, not the back. The back of the neck is primarily muscle and the spinal column. The front contains the airway, the major blood vessels, and the structures where physical pressure could leave evidence, if that pressure occurred at all. That entire area is what forensic pathologists refer to as the neck block, and it is precisely the region that was retained by the state and was not released along with the rest of Nolan's body when it was sent to the second examiner. There are 3 specific things a forensic examiner would be looking for in a case like this, and understanding all 3 matters because at this point, no independent examiner outside the state's office has been able to determine whether any of them are actually present. It's a small, delicate, horseshoe-shaped bone located high in the front of the throat. Unlike many other bones in the body, it is relatively unprotected. It is essentially suspended by muscles rather than being firmly connected to another bone the way much of the skeleton is. In some cases involving manual strangulation, pressure can fracture the hyoid. Whether that bone is intact or broken can therefore provide an important physical clue for a pathologist. Second are the strap muscles. These are thin muscles that run along the front of the neck, just beneath the skin. When significant compression occurs, tiny blood vessels within those muscles can rupture internally, creating evidence that a trained examiner may be able to identify even when there is no obvious injury visible on the outside. Third are petechiae, tiny pinpoint hemorrhages that can occur when small blood vessels rupture under sustained pressure. They can appear in areas such as the eyes, face, or even the lining around the heart. None of these findings by itself proves manual strangulation, but when multiple findings appear together, they can form a recognizable pattern, and recognizing patterns is one of the foundations of forensic pathology. All 3 potential indicators involve the exact region that was retained and never transferred, which means that right now, no independent examiner has been able to confirm or rule out any of them. So here's the question we actually want debated in the comments. If you were the parent in this situation, Would knowing that retaining tissue is a common forensic practice be enough for you to accept not knowing what was found? Or would you want that tissue released immediately once a second opinion was requested? Procedure or not? Comment, procedure is fine, or release it now. Then go debate with the people who chose differently. That's what this comment section is actually for. And to be fair, we're going to keep approaching this carefully throughout the entire discussion. Retaining tissue during an investigation is not automatically suspicious. Medical examiners do it routinely. Sometimes material is preserved for additional testing. Sometimes it is retained as evidence precisely because something potentially significant was discovered. By itself, retention does not prove wrongdoing. But here's why it still matters, and why simply saying it's standard procedure doesn't completely resolve the issue. If the state retained that tissue, then the state also examined it. Whatever was discovered during that examination should already exist somewhere within the original autopsy documentation, a report the public still has not seen. The retention itself is not necessarily the scandal. The unanswered questions surrounding it and the lack of transparency after all this time are what deserve scrutiny. There's another complication sitting right beside this one, and it sounds straightforward on paper but can become seriously misleading if you don't know what to look for: toxicology. A number printed on a laboratory report can look completely objective, but in a case like this, that number cannot automatically be taken at face value. We covered the reason earlier. Decomposition can produce alcohol inside a body entirely apart from anything Nolan may have consumed while alive. In a body that has undergone substantial decomposition, that internally produced alcohol can potentially rise high enough to cross a legal threshold because of bacterial activity rather than actual behavior. And considering how many days Nolan's body remained in the water before recovery, any alcohol-related toxicology result needs to be interpreted with decomposition in mind. It cannot simply be treated as proof of intoxication. Anyone using a raw number as definitive evidence of intoxication, without accounting for that context, is working with only part of the picture, regardless of which side of the argument they are trying to support. Now comes the development nobody was expecting this week. This is where the case has suddenly moved in a direction that connects directly to something we've discussed before. The disputed audio from that emergency call, the recording where people online insist they can hear a name, a question, or a warning. At the National Urban League Convention, standing alongside Nolan's parents, Ben Crump made an announcement that could significantly change the conversation surrounding that recording. His legal team has retained some of the country's leading audio engineering specialists to conduct a formal review of the original call in its entirety. Not a short clip, not a 15-second excerpt. The complete recording subjected to a professional forensic examination. Think about what that actually changes. For weeks, nearly every interpretation of what is supposedly being said in that recording has come from people outside any formal investigative process. A content creator running the audio through AI, an audio engineer posting a personal analysis on social media, commentators arguing about what they believe they can hear. But none of those efforts were formally authenticated, and none came from experts officially retained in connection with this specific case. That changes now. For the first time, the audio is being formally examined by professionals directly engaged by the family's legal team, experts with the training, resources, and credibility to potentially determine what is genuinely present on that recording and what is not. So we want your honest prediction, not simply what you hope the answer will be. When these experts complete their examination, do you think they'll confirm that something disturbing can actually be heard in that audio? Or do you think their conclusion will be that the disputed portions are simply too degraded to support anything definitive? Comment, confirms something, or inconclusive. And when the actual results come out, whoever turns out to be wrong has to admit it. We're holding you to that. Trump also announced another development in that same moment that has received far less attention than it probably should. His team has brought in oceanic engineering experts specifically to examine the tides. Here's the central issue he raised at the podium. Nolan's body was reportedly discovered essentially in the same location where his friends said they had left him. And Crump's question is simple and, at least on its face, difficult to dismiss. How is that possible? especially when you account for the actual tidal movement in that stretch of water across 2 full days. Low tide, high tide, currents, drift, all of those factors should potentially have affected where a body ended up over that amount of time. And Crump is publicly arguing that the calculations presented so far simply don't add up. But we need to be fair here, just as we've been throughout this discussion. We do not have the oceanic engineering findings yet. Nobody does. This review was only just announced. It is entirely possible there is an ordinary, current-based explanation for why a body could remain much closer to its original location than people might expect, depending on the wind, the water depth, and the exact position in the water. It is also possible that Crump is correct, and something about this specific detail does not withstand serious examination. We are not going to pretend we know which explanation is correct before the actual experts have completed their work. What we can say is that this question has now moved beyond an online suspicion. It is being formally examined by professionals, and that distinction could matter enormously for what happens next. One final question before we move on. Do you genuinely believe official investigators should have brought in tide specialists themselves months ago, instead of the family's legal team having to initiate that review? Or is this simply the kind of technical detail investigators normally examine quietly behind the scenes without making a public announcement? Tell us what you actually think. We want disagreement in this thread, not everyone repeating the same opinion. There is one sentence Dr. Roger Mitchell said publicly that deserves much more attention than it has received, because it completely reframes the question this case is actually trying to answer. When Dr. Mitchell says Nolan drowned, that statement by itself does not explain what happened to him. Drowning can be the accurate technical cause of death while leaving the most important questions completely unanswered. Was Nolan conscious when he entered the water, or was he already unconscious? Was he forced into the water, or did he enter voluntarily? A cause of death determination cannot answer those questions by itself. Those answers come from everything surrounding the death, and right now that surrounding evidence is still incomplete. That incompleteness is not vague or theoretical. There are specific pieces of information that remain unavailable. Ben Crump explained exactly what is still missing during the press conference. His team is actively trying to coordinate with Dr. Mitchell so that the doctor can finally examine the throat structures that were retained by the state and were not released with Nolan's body. At the same time, they are seeking direct access for Dr. Mitchell to the photographs and observations documented by the state medical examiner's office when Nolan was initially discovered. Because by the time Dr. Mitchell received the body on July 10th, the state examiner had already dissected the airway and lungs. Without access to those original structures, Dr. Mitchell could not independently determine whether water was actually present inside them, and that is one of the basic physical indicators that can help distinguish a person who truly drowned from someone who may have died by another mechanism before entering the water. Take a moment with that before we continue and tell us honestly what you think. Dr. Mitchell, a board-certified forensic pathologist and president of the National Medical Association, did not have access to Nolan's lungs, airway, or throat structures when he examined the body. Is that simply the unavoidable sequence when two separate autopsies are performed, or is it genuinely difficult to accept that the independent examiner was working without a substantial portion of the original physical evidence, sequencing or suspicious? Pick one and argue your position below. Here is what is actually being requested now, and it is important to describe it accurately because precision is the only thing that keeps a case like this grounded in reality. Nobody is asking the state to simply surrender its evidence and walk away from the investigation. What the family is seeking is access. They want Dr. Mitchell to directly examine material the state already possesses so an independent expert can evaluate the exact tissue that could potentially confirm or rule out strangulation, instead of having that determination exist entirely within the private records of one office. To be fair to the state's position, retaining evidence during an active investigation and carefully controlling who can access it is not automatically obstruction. If a criminal investigation is still underway, restricting access to physical evidence can be a legitimate way for prosecutors and investigators to protect the integrity of what may come next. A grand jury, potential criminal charges, possibly even a future trial. Both realities can exist at the same time. The state can be following normal evidence procedures, while the family can still have every legitimate reason to push aggressively for its independent expert to examine that evidence. Neither side is automatically wrong. And that is precisely why this remains a disputed, unresolved issue rather than a settled conclusion. Now, the phones nobody has been talking about. Here is another detail from that same press conference that is genuinely new, and it has received far less attention than it deserves because so much of the focus has been placed on one phone. Attorney Eric Hers, who is part of the family's legal team, provided an update that significantly expands this entire line of inquiry. According to him, the district attorney's office has responded in writing and expressed a willingness to consider some of the evidence the family's team has collected. The precise details of what will be exchanged between the two sides are still being worked out, but more importantly, both sides have reached what he described as a tentative agreement to pursue a joint investigation involving the phones, plural. Not just the devices belonging to the family's clients, other phones connected to this case as well. Think about what that actually means for a moment, because it is easy to hear one plural word and move right past it. For weeks, the public conversation has centered heavily on Nolan's phone. What was deleted? What was not deleted? Why the device appeared the way it did when his family eventually received it. But if multiple phones are now going to be included in a coordinated investigation, then investigators are not only asking what happened to Nolan's device, they are also asking what information exists on other devices, phones belonging to people who were present that day, people who were on that boat, people who were on that island. That represents a substantially broader scope than anything that had been publicly confirmed before this announcement. Here's the real question, and we want your instinctive answer, not the carefully worded one. If you were one of the friends on that boat and investigators told you that your personal phone was now going to be part of a joint forensic examination, would that feel completely routine to you? Or would it feel like the investigation was getting much closer to home? My phone, no problem. Or, I'd be terrified. Pick one and explain why. And don't simply follow the first comment you see. Think about it yourself. Hers also confirmed something that connects directly to what we discussed in part 2. He said he believes the FBI will be involved in this joint phone examination, which is consistent with information that has already been confirmed separately. The Bureau is assisting with digital evidence as a supporting resource for the local investigation, not taking control of it. Having federal forensic resources directly involved in this specific examination represents a meaningful increase in the technical capability available to investigators compared with what either side could accomplish independently. According to Hers, that involvement could uncover information that no one connected to this case has been able to see so far. But we also need to be honest about the limits of what we know, just as we've been throughout this entire discussion. A tentative agreement does not mean the examination has already happened. A letter expressing a willingness to cooperate is not the same thing as evidence already being exchanged. Everything Hers described represents a meaningful potential step forward, but it is still a step, not the final destination. The actual joint examination, if and when it takes place, is what could finally begin answering the questions this case has been carrying for weeks. One final question for this part. Do you believe a joint examination with the family's experts and the state's experts working together in the same process could actually produce an answer both sides accept? Or do you think whichever side dislikes the outcome will eventually argue that the process itself was compromised? Tell us honestly. We're not convinced either way, and we want to hear your take.
So we can't tell if there was the presence of water or not. That would suggest whether he drowned or not. And remember what Dr. Roger Mitchell said in his autopsy. President Mariel, he talked about the fact that to say he drowned does not draw the conclusions of what happened to Nolan Wells. He said it is equally important to know at what condition was Nolan Wells' body when he went into the water. Was he conscious or was he unconscious? Was he forced into the water, or did he go unforced into the water? He said all of these things are very important. And so we're dotting I's and crossing T's. We are focused on getting to the truth, and we stand for the truth. Me and everybody on my legal team stand for the truth, no matter who it implicates or who it exonerates. Yes. We stand for justice, no matter who it convicts or who it acquits. And we stand for transparency, so everybody can see. And that's all we want. We want answers. We're not casting aspersions on anybody. We are saying that we want to make sure everybody who is remotely involved has their questions answered, to make sure we have a full and fair and impartial and transparent investigation. And is that too much to ask for these broken-hearted parents? Is that too much to ask? That's all. If it was your child, wouldn't you want the same thing? And I get it. They're attacking me. They're attacking Reverend Al. They're attacking the parents of Nolan Wells. We don't care about those distractions. We ain't no ways tired. We are completely focused, completely laser focused on getting to the truth, the whole truth, and nothing but the truth. So help us, God.
Toward the end of that press conference, a reporter who identified herself as being with the New York Post asked Ben Crump directly about something that has received very little attention so far, an alleged threat to sue him and Nolan's own family for defamation. His response was immediate and pointed. He dismissed it as a distraction, said it was not slowing them down, and made it clear that the family's priority remained finding the truth, not responding to legal threats that, in his view, were designed to silence them. When the reporter pressed him for more, Crump refused to give the accusation additional attention. He said plainly that it did not deserve a response, and that he was not going to waste his energy arguing with people he believes are trying to distract from the deaths of 3 young men under circumstances he described as suspicious. We need to slow down here, because this is a genuinely serious development. Regardless of which side you take in this case, threatening a grieving family with a defamation lawsuit over public statements made while they are actively trying to understand what happened to their own son is not something insignificant. At the same time, it is not something we should casually dismiss either. If that threat is genuine and eventually becomes an actual lawsuit, it creates an entirely separate legal battle on top of everything this family is already dealing with. But if no lawsuit is actually pursued and the threat was made primarily to intimidate them, that raises a different and equally serious concern. Because threatening defamation litigation against grieving parents without intending to follow through can function as a form of pressure rather than a genuine legal claim. So here's what we want debated tonight. Is threatening a defamation lawsuit against grieving parents while they are actively trying to uncover what happened to their child a legitimate legal response to being publicly accused or named? Or is it a pressure tactic being presented as a legal remedy? They have a right to sue, or this is intimidation. Choose a side and defend your position. We want genuine disagreement in this thread tonight. Crump also addressed another issue that deserves to be included because it is the kind of detail that gets used against both sides online. When asked, essentially, about his own financial interest in cases like this, he responded that he is a lawyer, just like any other attorney, and that he deserves to be compensated for the work he performs. He compared that to the way people generally do not question whether a corporate defense lawyer or an insurance attorney gets paid for their professional services. That is a reasonable point on its own terms. At the same time, it is also reasonable for people following this case to want transparency about how the legal effort is being financed, who is paying for specific services, and where publicly raised funds are ultimately going. Both things can be true at the same time. And neither one by itself tells you whether the underlying case has merit. Now, why Nashville? And why bring these 3 families together? There is something important about the setting of everything we've discussed tonight, because it changes how you should understand the broader event. This was not simply a standalone Nolan Wells press conference. It took place at the National Urban League's National Convention. And Crump did not appear alone. He brought the families of two other young black men whose deaths, occurring within roughly the same 3-month period around the summer of 2026, have been described by his legal team as sharing striking similarities. That includes Daniel Irvin's case out of Texas, which we covered extensively in a previous update on this channel, along with a newer case from Lexington, Kentucky, involving an 18-year-old named Tyler Smith. We are intentionally going to keep this section brief, and there is a good reason for that. The reporting and first-hand accounts we have received about Tyler Smith's case are not as clear or consistent as the information available in Nolan's case or Daniel Irvin's, and we are not willing to manufacture details we cannot independently verify simply to make this section longer. What we can responsibly say is this. According to the statements made publicly in Nashville, Tyler Smith died during the same 4th of July weekend as Nolan. He was reportedly the only black person at a small gathering, and his family was initially told that his death involved what was described as a self-inflicted gunshot wound. His family has publicly challenged important parts of that account, and the case has reportedly progressed slowly since then. We want to be completely transparent. This is less certain ground than much of the material we have discussed tonight, and that distinction matters. So tell us what you would prefer. Would you rather see a case like this covered cautiously and broadly until more information can be properly verified, or would you rather we leave it out completely until everything has been fully confirmed, even if that means you hear about it here last? Cautious coverage or wait for full confirmation. Tell us which approach you would actually want from a channel like this. The reason Crump brought these three families together in the same room goes beyond any single case. His argument, stated directly from the podium, is that all three situations share a recognizable pattern. A young black man dies under circumstances that do not initially receive the level of scrutiny some believe they deserve. An early institutional response appears to close the door before the available evidence has fully justified doing so. And then the family is left fighting to force a deeper investigation. Whether that common pattern points to something structural, or whether these are simply three separate tragedies that happen to share certain surface similarities, is exactly the question this entire event was designed to place before the public, and it is not a question either side gets to answer on its own. We also want to say something plainly, because it can be easy to lose sight of it in a discussion this dense, with legal strategy, forensic evidence, and competing claims. Whatever you believe about any individual piece of evidence in Nolan's case, three families are sitting together because each of them has lost a son under circumstances they believe have not been fully explained. That is not something to argue past. That is the human center of everything we have been discussing tonight. One final question for this part. Do you think bringing three separate cases together strengthens each individual case? More attention, greater pressure, and broader scrutiny? Or does combining them risk weakening Nolan's specific case by asking the public to process three different sets of facts at the same time, stronger together, or dilutes each one? Tell us which you believe, and explain why. We want to see this thread genuinely split.